We are also blessed to have wonderful elected officials at the federal level, and we are honored and thrilled to have with us Congresswoman Carolyn Maloney.
Thank you. Thank you for being here. Thank you for speaking out in support of Dr. Tiller, our hero, and for speaking to keep abortion legal. The hatred that played out inside a Wichita church yesterday is a wound to the conscience of our nation. Dr. Tiller had long been a target of violence and hate. He provided medical care to women in need, and there are people in this country who have elevated the rhetoric of hatred against abortion providers to a murderous level. Abortion is a right, and it is legal. It is needed medical care, and providers should not have to risk their lives to help women. Yes. Yes. We have seen that throughout history, that hate is not just ugly, it can be deadly. I hope that responsible leaders on the other side of these debates will look at the events of this bloody Sunday and call to account those who would use hate to divide us, fear to control us, and intolerance to rule us.
Rally!
Dr. Tiller was gunned down as he and others were gathered to worship peacefully. There is a terrible irony that individuals that claim they are acting on God's behalf would not only take a human life, but do so in a church. It takes incredible valor to do what Dr. Tiller did all these years. Dr. Tiller has been shot and attacked before, and he knew that he was a target of extremists. And he carried on his work because he also knew that there are thousands and thousands of women in our country who had nowhere else to turn. Anytime a doctor has to put his life on the line to perform medical care, it has a chilling effect on Americans' ability to get the care they need. The consequences of Dr. Tiller's murder are a tragedy, not only for women in Kansas, but women for everywhere across our country and all the areas in our country where there are very few medical providers. Dr. Tiller did not start off as an abortion provider. He started off as a dermatologist. He became a provider because women needed him. Women came to him and asked for the service. They said, "Your father helped us. Why can't you?" And because there were no one else in the area that would help, Dr. Tiller started performing this very needed service because women needed him. The question for all of us is, how can we try to ratchet down the hate and venom that turns medical providers like Dr. Tiller into targets of brutality? How many more doctors are going to be willing to put their lives on the line just to do their jobs? Why should they have to? Dr. Tiller is the 8th abortion provider murdered since 1977. Dr. Tiller was one of just 7 doctors in the entire state who would provide abortions. Where will women go? We have seen that throughout history that hatred is not only ugly, it is deadly. And I hope that leaders in Congress and in our state houses and in our communities will come together and look at this savage killing and call to account those who would use hate and intolerance and fear to divide us. My heart goes out to Dr. Tiller's family and friends. My prayers are with him. Along with like-minded men and women in Congress, I will be putting forward a congressional resolution to honor the life and sacrifice of Dr. Tiller. And I thank you for being here today to speak out in support of him and to honor him and to honor his life. Thank you.
Thank you, Congresswoman Maloney. Thank you for taking all the thoughts and prayers and hopes of everyone here back to Washington and for that resolution. Thank you very, very much. You have heard a lot of people talk today about women who traveled to Kansas to see Dr. Tiller because he was their last resort. Many of you know that those trips cost a lot of money, that those procedures cost a lot of money, and that these are often, as a matter of fact, they are never anything that people plan. And what we need across the country is a network of people like the people in this gathering tonight who help support those women to make sure that they have the money that they need in order to travel, in order to take a partner or a friend with them, in order to get the care they need. We have abortion funds across the country, and we have one here in New York that helps to do that work. And I would like to bring to the stage Constance DeCherney with the New York Abortion Access Fund to speak to you all.
Hi everybody, thanks so much for coming tonight. Thank you so much, Mary Alice, for introducing me. I'm the chair of the New York Abortion Access Fund, and with you tonight are the other board members. We're an all-volunteer nonprofit operating here in New York. We provide financial assistance to low-income women seeking abortions from New York State and in New York State. We're also a member of the National Network of Abortion Funds, a network of over 100 grassroots organizations in 40 states. Sorry. Together, we provide the funding to make up the difference between women's access. Over the last 8 years, since NIAF's inception, we have funded women seeking safe and affordable abortions. We have sent women to Dr. Tiller numerous times as the last resort in carrying a child or having the choice that they wanted to make. I think the hardest question for us today is, where will those women go tomorrow? And we don't know the answer to that. There's a temporary solution. But with so few options left, New York has to legislate to make the barriers wider. Dr. Tiller provided critical reproductive health care, including abortion services, to women facing some of the most difficult medical circumstances. His death is an enormous loss to NIAF, for the patients who relied on him, his incredibly dedicated staff, the medical community that supported him and he supported, and mostly to the women and their families across America who relied on his care. Our thoughts and prayers go out to his family and those close to him who are suffering a personal tragedy today and in the coming weeks, months, and years. In response to Tiller's tragic murder, the network of abortion funds across the country has responded to activists like you, to donors, and to other funds' requests to do something today. And the answer to that is what Dr. Tiller did so well, was provide more access. In his honor, the National Network of Abortion Funds has created the George Tiller Fund for Women. Myra Batchelder, another NIAF board member and employee of NARAL Pro-Choice New York, is here collecting funds to help women provide further access to their own reproductive health care. Thank you.